esta conferencia, les invitamos a pasar a este auditorio y poder participar de la conferencia Introducción a Irrisept, tratamiento y prevención de infección en el sitio quirúrgico y cuidado avanzado de heridas. Será una conferencia en inglés con traducción simultánea. Usted podrá adquirir unos audífonos. Le pedimos, por favor, que pueda dar alguna identificación. Al final de la conferencia se le regresará su documento cuando usted entregue los audífonos correspondientes.
La evolución de las tecnologías y así elevar los estándares de la industria en la seguridad de la terapia.
Hello.
Perdóname, no hablo español. My name is Tina King.
Me llamo Tina King, soy directora de asuntos médicos para la empresa Max. Y para Irrisept, la presentación el día de hoy trata de infecciones en el sitio quirúrgico y distintos productos para evitarlos. Todo cuanto comento el día de hoy está basado en la evidencia en ciencia y de hecho son estudios basados en evidencia. Si tienen preguntas, podemos tener una sesión de preguntas y respuestas al final de la sesión. Muchísimas gracias. El primer punto que tocaremos son las infecciones en el sitio quirúrgico en los Estados Unidos. La tasa de infección para los Estados Unidos es de cerca de 300,000 infecciones o ISQs que se presentan año con año. 2 a 4% de pacientes hospitalizados desarrollarán una ISQ durante la estancia hospitalaria y sube en un 15 a 25% si es que tienen cirugías intraabdominales. Los pacientes que desarrollan una ISQ tienen 2 a 11 veces más riesgo de muerte. Son 75% de las muertes entre pacientes con ISQ son directamente atribuibles a la ISQ misma y puede provocar también discapacidad en el largo plazo. Las ISQ son una de las causas de hospitalización después de la cirugía y aumenta la estancia hospitalaria en unos 10 días por evento. Las infecciones en el sitio quirúrgico en México, de acuerdo con el Departamento de Epidemiología, la tasa de ISQ es entre 9 y 46%, dependiendo del tipo de institución de salud, al igual del nivel socioeconómico del paciente. Se estima que hay un 15 ISQs que se presentan por cada 100 cirugías. También incrementa la estancia hospitalaria de 7 a 20 días. Los pacientes que desarrollan una ISQ son 5 veces más probables de ser rehospitalizados. La mortalidad para pacientes que desarrollan ISQ es de 25%, es un cuarto de los pacientes que desarrollan una ISQ van a morir de ella. Al igual en los Estados Unidos, los pacientes son 12 a 11 veces más probables de morir, y el costo de un ISQ gira alrededor de 124,000 pesos mexicanos. Las próximas láminas abordan algunos artículos que discuten los sitios quirúrgicos en distintas especializaciones en México. El primero es un estudio de neurocirugía que investiga 41 pacientes que desarrollaron ISQ. Hubo un total de 737 pacientes. El estudio analizó factores intrínsecos en comparación con extrínsecos. Los primeros es la presencia de enfermedades crónicas o craniotomías debidas a causas no traumáticas. Los factores extrínsecos fueron procedimientos realizados durante el turno de noche, otras cirugías en el mismo sitio quirúrgico. Entonces, los factores extrínsecos fueron 1.7 veces más altos que los intrínsecos. Los pacientes sometidos a craniotomía con factores extrínsecos tienen una mayor asociación comparación con las ISQs.
This next study, it's an oncology SSI, and it was surgical site infections at the National Cancer Institute in Mexico. And this is a case control study. The study looked at 3,372
analizó
surgeries. Of those
3.372
surgeries,
cirugías.
313
De
patients
estas,
developed an
313
SSI.
pacientes
So at a rate of
desarrollaron
about
una ISQ
9.3
a una
surgeries
tasa
per
de
100.
9 por 100 cirugías.
The most common bacteria
Las
that were
bacterias más
cultured
comunes
were
que
E.
se
coli,
cultivaron fueron
Pseudomonas,
Escherichia coli,
Staph
Pseudomonas,
aureus, and
Estafilococo
coagulase
aureus
negative Staphylococcus.
y Estafilococo
Risk factors
negativo
for
a
these SSIs
coagulasa. Los
included
factores de
diabetes,
riesgo incluyen
obesity,
diabetes,
and then presence
obesidad
of
y la
surgical
presencia de drenajes quirúrgicos.
This next study, it's
El
looking
siguiente
at
estudio
pediatrics.
analiza
So
la
it was looking at a
pediatría y
pediatric tertiary care teaching
analizaron
hospital in
un
Mexico
hospital
City.
de enseñanza de nivel
Of the
de
530
tercer nivel.
patients who were
De los
involved in the study,
530
428
pacientes,
followed up. The overall SSI rate
la
in this
tasa de
population was about
ISQ total fue de
18.7%. The highest rate was in
La tasa más
neurosurgery
elevada fue
with
encontrada en
22%, and then
neurocirugía
followed by
con
general surgery at
22%, seguido
21%,
por
and
cirugía
then
en
cardiac
general con
surgery at
21 y cardiovascular
0.5%.
con
The wound
0.5%. La
classifications on
clasificación
these
de las
infections
heridas en esas
were
infecciones
primarily
fueron
dirty and clean
principalmente
contaminated. Those had the highest infection
heridas
rates within this patient
contaminadas y
population.
sucias con la mayor tasa de
This last study
infección.
that I'll talk about,
El último
it was a
estudio que
prospective
mencionaré
cohort
fue
surveillance
un
study, and it was
estudio de
comparing
vigilancia
SSI
de
rates in 5
prospectivo
Mexican
de
hospitals
cohorte en
with
hospitales
hospitals that were
México,
part of the International
en
Nosocomial Infection
hospitales
Control
que
Consortium,
forman parte
or the
del consorcio de
INICC,
control
and
de
they compared
infecciones
that to
nosocomiales
SSI rates in the
internacional
United
y
States.
se comparó con las tasas de
The
ISQ en los
procedures were
Estados
classified
Unidos.
into
Los
11
procedimientos se
types of
clasificaron
surgeries
en
based
11
on
tipos de
billing criteria
cirugía
or ICD-9
dependiendo de
criteria.
los criterios
So they looked at
ICD-9.
5,063 surgical
Analizaron más de
procedures,
5,000
and of those,
cirugías y de entre
312
ellos
of those patients developed an
312
SSI.
pacientes
And so
desarrollaron
as you
una
can see
ISQ.
on
Como
the
pueden
chart
observar
here,
en esta tabla,
the SSI rate was higher
la tasa de
in the Mexican
ISQ fue más
hospitals
elevada
versus
en
the
los hospitales
INICC
mexicanos
versus
en
the
comparación
CDC.
con el
The rates,
CDC.
SSI rate
La
was
tasa de los
73% higher than the
fue
CDC, and the rates
73%
were
más
about
alto que el
27% similar to the
CDC
CDC.
y
Compared to
27% similares
INICC, the
al
rates were
CDC.
45%
En
higher in
comparación con
Mexico, and they were
INICC,
23% similar.
fueron 45% más elevados en México y 23%
When we look
de
at
ellas fueron
irrigations
similares.
that
Cuando
surgeons use
analizamos
during
las
surgery,
irrigaciones de las
everybody
heridas
uses a little
quirúrgicas,
bit
todo el mundo utiliza
different concoction of things. Some people use
cosas un poco distintas.
antibiotics,
Algunos
some use
utilizan
antiseptics,
antibióticos, otros
some use
antisépticos,
antifungals, and
otros
others just use like
antifúngicos y
normal
otros
saline or
utilizan
sterile water.
solución salina normal o agua.
Irrisept. So Irrisept is
Entonces,
a product of Irrimax
Irrisept
Corporation,
es
which is
un
who I work for.
producto de nosotros,
It is a Class 2 medical
es
device.
un
We are
dispositivo
licensed
médico
for
de clase 2.
distribution in
Estamos
Mexico.
autorizados para su distribución
Irrisept
en
is a
México.
solution for wound
Irrisept
cleansing and
es una
debridement in
solución
surgery.
para la
It's a
limpieza de
single-use manual
cirugía y
self-compression device
desbridamiento. Es
comprised
un
of
dispositivo que
0.05%
tiene
chlorhexidine gluconate
0.05
and
de gluconato de
99.95% sterile water.
y
The contents are
99%
sterile.
de agua
The outside
estéril.
package is sterile, so you don't have to worry about sterility
empaque es
issues
estéril,
when you're
el
using this
contenido
product
también,
versus
entonces
some
no
other
hay
products that you may
problemas cuando
use.
utilizamos
The
esos
CHG
productos
acts
en
as a preservative
comparación
in the
con otros.
solution.
Hay el
There are
gluconato
not
de
any
clorhexidina,
contraindications for
de hecho
Irrisept.
actúa como
We do have a couple of
conservador. No hay
precautions, and it's
contraindicaciones, solamente
precautions
hay
that are similar to any
recomendaciones. Y
type of
esas
product that
precauciones
has
son similares a
CHG or
las de
chlorhexidine
cualquier
gluconate. So you take
producto que
precautions
contiene
in eyes, ears, and then in any patient that
gluconato
might
de
have a CHG
clorhexidina.
allergy.
Y puede haber pacientes que son alérgicos
All
a
right, so a
ese
little about
ingrediente.
Irrimax
Un poco
Corporation.
acerca de nuestra empresa.
We've sold about a little
Hemos
over 200
vendido un
million
poco más de
lifetime units, shipped to 5
millones de
countries. We have
unidades
customers in
embarcados
5
a
different
5
countries.
distintos
We're in all
países.
50 of the U.S. states.
Estamos representados en los
We
50 estados
receive
en
about
los Estados
7,500
Unidos
clinical information
y
requests,
recibimos
and we have about
más de
1,750
7,500
hospital customers
solicitudes
globally.
de
And as far as the
información.
people that we have
Y en
working
cuanto
for
a
our
las
company, we
personas
have
que
greater
trabajan
than
para
850 years
nosotros,
of
tenemos más de
healthcare experience within
850
our
años
company.
de experiencia dentro de nuestra empresa.
So what is chlorhexidine
¿Qué es
gluconate?
entonces el gluconato de
Chlorhexidine is an antiseptic.
clorhexidina? Es
It's
un
an
antiséptico,
effective antimicrobial.
es un
It has been
eficaz
used
antimicrobiano y
in
se ha
medical
utilizado en
devices
productos o
for well
dispositivos
over 50
médicos por
years.
más de
It's a
50 años.
positively
Es
charged
una
molecule
molécula
that rapidly
cargada
binds to the
positivamente
negatively
que se
charged
une
bacterial cell
a
wall.
la pared
So it
celular
causes disruption of the
bacteriana
cell
con carga
membrane and then
negativa,
subsequently
provoca la
lyses
disrupción
the
de
cell
la
and causes
membrana
death.
celular y
It's
la
effective against both
subsiguiente
gram-positive,
muerte
gram-negative
celular.
bacteria,
Es efectivo
some
contra
funguses and some
bacterias gram
viruses.
positivas y negativas,
And
hongos y
with
algunos
CHG,
virus.
it's not affected by the presence
No está,
of
se ve
blood or other
afectado por
bodily
la
fluids,
presencia de
in
otros
contrast to
fluidos
povidone iodine
corporales,
that you may use
en
also
comparación
in
con
surgery.
povidona yodada, que se utiliza también en
We have
las
done
cirugías.
extensive safety and
Hemos
toxicity
realizado
testing before we
estudios
brought our product to
de
market because
seguridad
we wanted to
antes
make sure that
de
it was safe to use
comercializar el
on patients
producto porque
in the
tiene
body
que ser
cavity. So we
seguro en
have
las
done
cavidades
hemolysis testing,
corporales. Hemos hecho pruebas
pharmacokinetics,
de
intraperitoneal organ
farmacocinética,
toxicity,
toxicidad de
acute
órganos
systemic toxicity,
intraperitoneales,
neurotoxicity,
toxicidad sistémica
thoracic
aguda,
tissue toxicity,
neurotoxicidad,
intra-articular cell
toxicidad de
toxicity,
tejidos
and we also have a
torácicos
wound
y
healing study as
también
well. And
tenemos
so
un
all of this
estudio sobre
information is available
cicatrización,
to you
entre
upon
otros.
request.
Toda esta información se le puede proporcionar previa solicitud.
Another thing that we have done
Otra
is
cosa
what we
que
call
hemos hecho
kinetic
es
time
lo
kill
que
testing.
llamamos
And with this,
pruebas
we tested Irrisept against
de la
35 what we call
curva de
escape
tiempo
pathogens. And so
muerte.
these are pathogens
Esos son
that are most commonly
patógenos
cultured
que
in surgical site
normalmente se
infections.
encuentran en
And
las
so
infecciones del
what we
sitio
found with
quirúrgico y lo que
this
hemos
testing is
encontrado
that
con
we are
esas
effective
pruebas
against a lot of the
es
organisms
que
that you see in surgery.
Hay muchos organismos
Pseudomonas,
en la
MRSA,
cirugía como
C. diff,
Pseudomonas,
Staph aureus, all of these different things we're effective against. And so just like the other stuff, we can provide this to you if you wish to see it.
Patógenos. Y podemos
All right, the next
proporcionar con
things
gusto
we're
la
going to talk about
información.
are
Los
some studies that
siguientes
were
son
done in
algunos
some bigger
estudios que
hospital
hemos
systems
realizado
in the United
en algunos
States. And then I'll show
hospitales
you, after
grandes
this
en
slide, I'll show you the
Estados
slide
Unidos. Y
that
después
shows
voy a
what the
mostrar
economic
una
impact
lámina
of using
que
Irrisept was
versa
for
sobre el
these
impacto
facilities.
económico en estas
St. Joe's
instituciones.
is a big hospital in
es un
Southern
gran
California. It's in
hospital
Orange
en
County, California, part
en
of the
Orange
Providence St. Joe's Health
County.
System. So it's the third biggest health system
Es
in the
el
United
sistema
States.
más grande en los Estados Unidos
In
de
about
salud.
2015, they were having some issues with surgical site infections, and so
2015
they
tuvieron
wanted
problemas con
to
ISQs,
lower their infection
querían
rate, and so they
reducir la
called
tasa de
their program
infección,
Target Zero. And I'm
para
sorry, I started in
llegar
2012.
a la meta
And
de
so what they did
cero.
was they just
Lo que
changed some of
hicieron
their
es que
standardized
modificaron
processes that
algunos de
they
los
were using.
procesos
So,
estandarizados que
making sure that the
utilizaban
patients were
para
bathing with
asegurar
CHG
que
pre-op,
los
using CHG wipes when they got to the hospital. Making sure that there was a biopatch drain on their dressing on their drains if they had one, and then doing extensive pre and post teaching with their patients. And so what they found just with standardizing their care was they were able to lower their infection rate by quite a bit, but they weren't able to get to zero, which is what their goal was. In 2015, they came into contact with Irrisept, and so they were having a spike in their neurosurgery infections, and they decided that they would trial Irrisept in neurosurgery. And so they were going to do a 6-month trial, and then they would decide if they would move it out to their other specialties after that. After 90 days, they had 0 infections in their neurosurgical surgeries. And so then they decided that they would go ahead and move it out to their other implant-based procedures, so orthopedics, breast surgery, and spine. And so over the 6 months that they used Irrisept, they were able to lower their infection rate by 53%. They're still one of our biggest users today. They use approximately 400 units per month at their hospital. This slide here is what we call our healthcare economics. And so this is where we show you the cost savings based on that poster that I just presented to you. And so when you're looking at the cost of a breast implant infection, it's estimated that that costs about $10,800 US. With their use of Irrisept, they were able to lower their infection rate in that specialty from 16 to 0. And so that had a positive financial impact for them of $172,000. The same was true for orthopedics. It's estimated that it costs about $51,000 per orthopedic infection. they were able to lower their numbers from 7 to 1, and so that had a positive financial impact for them of a little over $300,000. The same was true in neurosurgery. The financial impact on that was between $158,000 and $439,000.
Eran
This next poster was presented. It's a hospital in the northeast part of the United States called UHS. There's about 13 hospitals involved in this health system. They were looking at reducing their colon surgical site infections. When they started their process, their infection rate was in the teens. In the United States, there are different surgery procedures that have to be reported, and colon surgeries is one of them. And so hospitals are looking to drive down their infection rates because it affects the amount of money they get reimbursed for surgeries. So with UHS, they standardized their care similar to what St. Joe's did. They made sure the patients were receiving appropriate antibiotics, that they were keeping them warm during surgery, removing hair appropriately, keeping their blood sugar under control, and then making sure that they had appropriate wound protection as well as mechanical bowel preparation. And so with just those changes, they were able to lower their infection rate to about 6%. About this time, they came into contact with Irrisept as well, and they decided that they would add it to the bundle that they were already using. And so over the next year, they used Irrisept as part of their bundle, and they were able to lower their infection rate
productos que utilizan pudieron reducir la tasa de infecciones a 1%.
The healthcare economics piece attached to that is looking at a colorectal infection, which costs anywhere between $3,000 and $29,000 US. At the rate that they were able to reduce their infections using Irrisept, if you multiply that times 1,000 procedures, that would be a savings of $143,000 to approximately $1.3 million. If you multiply that times 10,000 procedures, that's a savings of $1.4 million to $13.8 million.
Esta cifra sube a 13 millones, casi 14 millones.
All right. This next paper, it's a paper that came out of Emory University in Atlanta, Georgia, and it was a plastic surgery paper, and it was comparing Irrisept to a triple antibiotic solution. So they used Ansef, bacitracin, and gentamicin. What you'll see on the left side of the graph, that's the triple antibiotic solution arm of the study versus the right side of the chart, which is Irrisept. The infection rate using triple antibiotic solution was 31.8% versus, complication rate was 31.8% versus total complication rate of 22.4%. The infection rate was 12.7% with antibiotics versus 6.4% with Irrisept. So everything was lower in complication rate, seroma, implant failure, etc. And when you look at the healthcare economics piece on that, it's estimated that a breast reconstruction infection costs about $6,700 US. And with the cost of treatment, so if you continue to treat with the triple antibiotic solution at a 12% infection rate, that would cost about $300,000 versus Irrisept, which would cost about $148,000. And so the savings on that patient population was about $150,000. So it's a pretty significant savings. If you multiply that times 1,000 patients, that's $425,000 in savings. Times 10,000 patients, it's $4.2 million in savings. So there's quite a bit of savings that can happen using Irrisept as part of your surgical irrigation. This next study, it's also a general surgery study, and it was looking at, it compared Irrisept to normal saline for closure of temporary loop ileostomy. And so this is important also because it's looking at colorectal surgery. And what we found in this study was that the infection rate in the Irrisept group was 4.8% versus 31.6% in the normal saline group. So that's about a 67% difference in infection between the two groups. There was also less incidence of seroma, incision dehiscence, time to healing, and asepsis score in
caracterización en el grupo de Irrisept.
Next, we'll talk about povidone iodine. Povidone iodine
povidona iodatada.
has been used
Esta
for
se ha utilizado
a long
desde
time in
hace mucho
surgery. A
tiempo
lot
en
of
las
surgeons will
cirugías.
use
Muchos
it. They'll pour it
cirujanos lo
unsterilarly
utilizan
into their normal saline or sterile
y
water, and they'll
lo
irrigate
mezclan
wounds
con
out with that.
la solución
Some of the issues
salina
that
y
you can
lavan las
have with
heridas con
povidone
esto.
iodine
Algunos problemas que podemos tener con
or it can
povidona
inhibit
iodatada
bone growth,
puede
and it can
inhibir
also
el crecimiento óseo y
have deleterious
también
effects on
puede
articular
tener
cartilage.
efectos
It's
negativos sobre el
estimated that
cartílago.
povidone iodine, it becomes inactive in the presence of organic matter, so sputum, blood, other body fluids. So approximately 50 milligrams of iodine is bound by 1 gram of hemoglobin.
Entonces,
And
aproximadamente
like I said
46
earlier, operating
miligramos
rooms
de
often
yodo
use
se
povidone
unan,
iodine that's not sterile.
son
And
unidas
so
por
a
1 gramo de
non-sterile solution that's
hemoglobina. Una
introduced to
solución
the
no
surgical wound
estéril
is
que
going to
se
change your wound
introduce a la herida
classification. So if your
quirúrgica
wound
cambia la
classification is
clasificación
clean,
de la
and
herida.
then
Si
you
se
add an unsterile
pretende una
product to that,
clasificación de
that will make
limpio
your wound
y se agrega un
classification
producto
clean,
no
contaminated, or
estéril,
contaminated.
eso convierte la herida
And
en
then also in excess
contaminada o
doses,
sucia.
povidone iodine
Y
can
en
cause
dosis
iodine
excesivas la
toxicity.
povidona iodatada puede ser representar un riesgo de toxicidad.
Okay, there we go. This paper is a meta-analysis, and it was looking to see if there was a difference in infection rate for orthopedic surgeons who use povidone iodine versus orthopedic surgeons who just use normal saline. And so this meta-analysis, it looked at 31,000 patients, and what they found was that there was no difference in post-op infection rates in povidone iodine versus normal saline. And so essentially, these surgeons are introducing an unsterile product
introduce un
to their
producto
wound,
no
and they're not really
estéril a
receiving
la
any
herida
benefits
y
from
no
that.
hay realmente un beneficio a partir de ello.
This next slide
La
is a
siguiente
quote from
lámina es
Dr.
una
Donald
cita
Fry.
del Dr.
He's a
Donald
professor
Fry.
at
Él es
Northwestern
profesor
University.
en Northwestern
And what
University.
this quote
Y lo
states
que
is
dice
the
es que la
bioactivity of
bioactividad de los
antibiotics against
antibióticos
bacteria
contra
requires an
bacterias
interval of
requiere un
time
intervalo de
for
tiempo
binding to
para que
target
se
sites on the
una a los
pathogen.
sitios meta
The
en
amount
el
of time for
patógeno.
transient
El
contact
tiempo
of the
para el
topical
contacto
antibiotic
transitorio
and the
del antibiótico
microorganism
tópico y
afforded by
el
irrigation makes it highly unlikely
microorganismo
that
lo hace poco
antimicrobial benefit
probable
will be
que un
achieved.
beneficio
So what does this mean?
antimicrobiano se logre.
So
¿Qué
when
quiere
we're
decir
using
eso?
antibiotics in our
Cuando utilizamos
irrigation,
antibióticos en el líquido
antibiotics
de
work by
irrigación,
binding to a
ellos
target cell.
funcionan al unirse
So
a
you need
una
enough
célula meta.
antibiotic over a
Entonces se
period of
requiere
time to reach a
suficiente
therapeutic
antibiótico
level
en cierto
in the
tiempo para
tissue
llegar a
for
un
the
nivel
antibiotic to
terapéutico
have
en
a
el tejido
therapeutic effect.
para tener
So
un
it's the
efecto
same as if you
terapéutico.
go to
Es
your
lo mismo
doctor
como
and
si
you
vamos
have a
al
bacterial
doctor y
infection and they
tiene
give you
una
an
infección
antibiotic. They tell you to take the
bacteriana, te dan
antibiotic for
un
7 days.
antibiótico, te dicen
And the
que lo
reason
tomes
for
por
that is you
7
want it to
días.
reach
Y
a
el
therapeutic
motivo es
level
que se
so that way it
pretende llegar
eradicates
a
the
un nivel
organism, right?
terapéutico
The same
para
is true
combatir el
if you're using
organismo.
antibiotics
Lo
in your
mismo
irrigation.
aplica cuando se
And so if
utilizan
you're
antibióticos en la
using
irrigación.
antibiotics
Cuando
currently
se
in your irrigation,
utilizan estos
chances
en
are
la
you're
irrigación,
probably squirting it into the wound and then suctioning it right back
lo
out. And
colocan
so
en la herida
it doesn't
y
have
lo
time to reach a
succionan,
therapeutic
de modo
level
que no
in
llega a un
order to be
nivel
effective and
terapéutico
to
para poder
eradicate
ser eficaz
organisms.
y erradicar los microorganismos.
Also, the use of
También
antibiotics
el uso de antibióticos
in surgical
en
irrigation,
la
it's fairly
irrigación
commonplace. I think it's
es
something
muy
that's been
común
around
y creo
for
que es algo que
decades.
se ha hecho durante
There
décadas.
really isn't a way
Realmente no hay
to
manera
compare
para
whether
comparar
one antibiotic
si
works
un
better than
antibiótico
another
funciona
one. And the reason
mejor
for
que
that
otro, y el
is
motivo para ello
people use
es que la
different
gente
doses,
utiliza
different
distintas
concentrations,
dosis,
different dwell times, and so
concentraciones,
you're
tiempo
really
de
not
permanencia.
comparing
De
apples to
verdad
apples.
que
It's more
no
of
se
an apples to
comparan
oranges
manzanas con
comparison.
manzanas, sino manzanas con naranjas.
And there's conflicting evidence that demonstrates
hay
that there's even
evidencia
any
que
clinical
muestra
efficacy to
que
using
no hay
antibiotics.
eficacia
They've
clínica en
been
el uso de
implicated in
antibiótico.
allergic
Y luego
reactions
se implican en
to
reacciones
antibiotic resistance,
alérgicas,
and then also tissue
resistencia a los
toxicity when
antibióticos,
bigger concentrations are
toxicidad
used.
tisular cuando se
As far
utilizan
as
distintas
safety,
concentraciones. En
there's
cuanto a
not
la
there
seguridad,
is sufficient evidence to support some of the
existe
following
evidencia suficiente
recommendations.
para apoyar
One
la
of the biggest
siguiente
recommendations
recomendación. Una de
is
las
eliminating the use of antibiotic solution for surgical irrigation.
Para la
The
irrigación
World Health
quirúrgica.
Organization
Y la
publishes what they call the
publica
global
lo que
guidelines for
llaman
infection
directrices
prevention.
para la prevención
And
de
some of the statements
infecciones.
that came from
Algunas de
those
las
guidelines
citas dentro
are
de estas
that
directrices son
antibiotic
el
incisional wound irrigation before
irrigación
closure
con
should not
antibióticos
be
en la
used for the
herida
sole
antes del
purpose of
cierre
preventing
no debe
surgical site
utilizarse
infections.
solamente para evitar
It also
las
states that this
ISQ.
practice is
También comenta que
associated
esta
with an
práctica se
unnecessary risk
asocia
of
con un
antimicrobial
riesgo no
resistance.
necesaria de
And if you're
resistencia
unfamiliar with
antimicrobiana. Si no
the issues, the worldwide
conocen los
issues with
problemas a
antimicrobial
nivel
resistance,
global en cuanto a la
it's
resistencia a
estimated that
antibióticos,
if we
se
don't
estima
do anything
que si no
about
hacemos
antimicrobial
nada acerca
resistance,
de la resistencia
worldwide, it
a
will
nivel
drive
global,
20 million
va
people
a
into extreme
llegar-
poverty
va
by
a
2030.
haber
If we still
pobreza
don't do anything
extrema de
else
20
about
millones de
antibiotic
personas
resistance,
si
that
no
by
hacemos
2050,
nada al
10 million
respecto.
people worldwide will die
Y
because
puede
of it,
mucha
because we
gente
just
morir
don't have
porque
the
simplemente no
resources
tenemos los recursos
to treat patients
para
that develop
tratar a los
these
pacientes que
resistant
desarrollan
infections.
estas resistencias o infecciones
So in the
que son
U.S.,
resistentes a los
part of what we're looking
antibióticos. En
at
los Estados
nationwide
Unidos, lo que vemos
is
a nivel
what we call
nacional
antibiotic
es lo
stewardship.
que
And so this is
llamamos
making sure that the way that we're using antibiotics
fomento de
is
antibióticos
appropriate,
para
that we're
asegurar
not
que se lo
overusing them or
utilice
misusing them.
adecuadamente y que no haya
And one
un
of the things
uso excesivo.
that the
Una
FDA
de
has
las
done is
cosas
when
que ha hecho
when they're
la
aware
FDA,
of physicians that are using antibiotics for, say, irrigation, they go back to the makers of these antibiotics and they ask them to have it to give information to get a surgical indication for it. And so one of the biggest antibiotics that was used nationwide was called bacitracin. Bacitracin came to the market probably in the mid-1900s. It was FDA approved to treat infants that had empyema and pneumonia. Shortly after it came to the market for those uses, they found that these babies were having kidney failure, and then also there was a large number of anaphylactic reactions because of that, and so it stopped being used for that purpose. But at some point it was started to be used for irrigation and surgery, and so the FDA went back to the makers of bacitracin and said, please provide us with the proof that your antibiotic works in surgery, and then we'll give you a surgical indication for it. And so they were not able to do that because they knew that it didn't work that way. And so the FDA withdrew it from the market. And so I believe that this will be the first of many withdrawals that we'll see from the market from the FDA.
Tendencias que vamos a ver que la FDA retirará más productos
This
por ese
paper,
mismo
it's
motivo.
looking at pocket
artículo
irrigation during
analiza
reconstructive surgery
la
for plastic
irrigación
surgery.
durante
The authors of this
cirugía
paper, they
reconstructiva
polled the
plástica.
surgeons that are part of their Plastic Surgery Association, and they
Se
asked them
preguntaron
what the most
a los
common
cirujanos cuál
irrigants that
eran
they use in
los
surgery are,
irrigadores
as
más
well as what the
comunes
most common
utilizados
bacteria
y
that
cuáles
are
son las
cultured.
bacterias
And
más
what they found was
comunes.
that the
Y
most common
encontraron que
irrigation that was
la
used was
irrigación
an
más
antibiotic
común era
solution,
una solución
and in that was
antibiótica que
gentamicin,
contenía
Ansef, and bacitracin.
gentamicina, Ansef y bacitracina.
And the most common dwell time for them was about 2 minutes, so they let it sit in the wound for 2 minutes before they suction it out. And then on this graph here, you'll see the organisms that were most commonly cultured for this group of plastic surgeons. And so these researchers took the antibiotic solution that they used, and they measured it against the 5 most common organisms, and they looked at it at a 1-minute dwell time, a 2-minute dwell time, and a 5-minute dwell time. And so in this graph, 1 minute is the green bar, 2 minutes is the yellow bar, and 5 minutes is the orange bar. And what you'll notice for all of these organisms, the antibiotic was not effective at all at any of those dwell times. And in fact, in 2 of the organisms, there was more of the organism present after 5 minutes than there was at 1
después de
minute.
5 minutos que después del tiempo de 1 minuto de análisis.
The last antibiotic that we'll talk about is vancomycin powder. A lot of surgeons in the U.S. will sprinkle vancomycin powder into their wounds. Specifically, neurosurgery does it, as well as cardiac and some orthopedic surgeons. And so the thinking behind that is if they sprinkle this antibiotic powder into the wound right before they close the skin, that it will help prevent infection. And so this paper was looking at vancomycin powder in total knee
de vancomicina en artroplastia total de rodilla.
And what they found was that the SSI rate really wasn't different. It was different by 2
no fue diferente.
But the wound complications
Las complicaciones
were more
de
than
la
half
herida
in the
eran la
group that
mitad
did not
en el
get the
grupo que
vancomycin
no
powder,
utilizó el
as
polvo de
well as the healing
vancomicina.
time. The healing
Y
time was
igual el tiempo de
longer in patients that got the
cicatrización fue
vancomycin
mayor
powder.
en los
There's also
pacientes
evidence
que
that suggests
recibieron
that
el
patients
polvo de
that get the vancomycin
vancomicina.
powder
Y también
have
hay
more of an
evidencia que
incidence of
muestra que
seroma
hay una
after
mayor
surgery.
evidencia de
And
seroma
part of the reason for that is
postquirúrgica. Y
consistency
parte,
and concentration,
en parte
because you
el
can't
motivo es
really
la
measure how
concentración,
much of the
porque no
powder you
podemos
get in the
medir
wound, and
cuánto
so some
polvo
parts of the
entra
wounds are going to
en
have
la
more
herida. Entonces,
than
en
other
algunas
parts, and so
partes
that's
de
why
la
you
herida va a
have
haber más, en
wound
otras
healing issues
menos.
when you
Y por
use
eso hay problemas de
antibiotic powders.
cicatrización cuando se utiliza polvo de
The
vancomicina
last
en
thing that we'll
esas
talk
heridas.
about
El
is
último
biofilm.
punto es
Any surgeon
biofilme.
that
Cualquier
puts in an implanted
cirujano que
device into a
coloca un
patient worries
implante en un
about the patient
paciente se
developing a
preocupa
biofilm
que se
infection.
desarrolle una
The
infección por
CDC
biofilm.
estimates that up to
El CDC
70% of human
estima que el
bacterial infections in the
70% de las
Western
infecciones
world are
bacterianas
caused
en
by
el mundo
biofilm.
occidental son provocadas por biofilme.
Most of these prosthetic
La
infections
mayoría de las
occur
infecciones en prótesis se
secondarily to the
presentan
bacterial seeding
secundario
before
a
during
la
implant. So while the
siembra
implant is sitting
bacteriana
on
antes del
the back
implante.
table
El
or while
implante
it's
está
being placed
en la
into the
mesa
body by
o
the surgeon.
mientras que se coloca
The bacteria
en
will
el
attach
cuerpo,
to the
está
prosthesis,
esperando.
and then
Las
once
bacterias
attached,
se
colonies of the
adhieren a
bacteria
la
secrete components
prótesis
of the
y una
biofilm.
vez ahí las
So
colonias
once
de
the
bacterias
biofilm
secretan
attaches to the
componentes de
implant, it
biofilm
covers the
y
implant,
cubre
and it
el implante y
impedes
impide
antibiotic penetration.
la penetración del
It's estimated
antibiótico. Se estima
these bacteria can
que
survive
estas
for a long
bacterias
amounts
pueden
of time,
sobrevivir durante
and
mucho
even
tiempo.
when you're giving
Y aun cuando
antibiotics
se
in
aplica
concentrations that are
antibiótico en
1,000 times
concentraciones
what would otherwise
1000
be
veces
effective.
mayores a lo que
So
normalmente sería
this is why
eficaz.
surgeons are
Debido
more
a ello, los cirujanos
strict maybe when
son
they're
más
putting implants
estrictos
in is
tal vez
because they
cuando
don't
colocan
want their patient
implantes
to
porque no
develop
quieren que el
a
paciente
biofilm infection, because
desarrolle una
generally they have to
infección por
take
biofilme
that
porque
implant out,
generalmente tienen
let
que
the wound
volver a sacar
infection
el
heal, and then
implante,
put the
dejar que
implant back
sane
in.
la infección y luego vuelven a colocar el implante.
This last paper that I will talk
último
about,
artículo que
it was
quisiera
a
mencionar
paper
era un
that was
artículo
presented
que fue
from the Mayo
presentado
Clinic in
por
Arizona,
la
and it
clínica
was
Mayo
looking
en
specifically
Arizona y
at a staph
analizaba
epidermidis biofilm.
específicamente un
And they
biofilme
wanted
de
to compare chlorhexidine
estafilococo y
gluconate
querían
at 3 different
comparar gluconato
concentrations,
de
povidone
clorhexidina a
iodine at
3
4 different
concentraciones
concentrations,
distintas y
sodium
povidona
hypochlorite or
iodatada
Dakin
a 4
solution at 3
distintas
different concentrations, and then a
concentraciones
triple antibiotic
y un triple
comprised of
antibiótico
bacitracin,
que tenía
polymyxin B, and
bacitracina
gentamicin.
y
And they
gentamicina
looked
y
at
uno
a 1 minute,
tercero
a
y lo
5 minute, and a
analizaron
10
una
minute dwell time,
permanencia
and then
de
they
1,
also did a
2 y
21-day
5
subculture.
minutos.
And
Hicieron
if
un
bacteria was
subcultivo a
present at
21
any of these
días.
3 dwell times or at 21-day subculture, they deemed that antiseptic or antibiotic ineffective.
Que el
The results
antibiótico
of the
no
study
era
found
eficaz
that
si es que encontraran
0.1%
estas
CHG
bacterias.
was effective but was not clinically relevant because there are not any products available that have had any safety studies at this concentration. What they did find was that CHG at 0.05%, which is the concentration of Irrisept, was effective at all 3 dwell times, and then again at 21-day subculture. For povidone iodine, they looked at concentrations of 0.35%, which is normally what's used during surgery, 1%, 3.5%, and 10%. So 10% would be pouring it straight out of the bottle, undiluted. What they found, the result of that part of the study, was that at 10%, it was effective, but not clinically relevant, because if you pour straight povidone iodine out of the bottle, it's going to kill everything good as well as everything bad in the wound, and so it's not clinically effective for surgery. And then the other concentration that had some efficacy was 3.5% at 10 minutes only, and so 3.5% is going to be 10 times more than what's normally used in surgery. And then with the sodium hypochlorite and the triple antibiotic solution, they were not effective at any of the dwell times or at 21-day subculture.
en ningún tiempo de
And
permanencia
finally,
ni en el cultivo a 21 días. Y las oportunidades para ustedes para utilizar Irrisept en las cirugías, en la ortopedia, cuando se hace reemplazo de articulaciones, trauma, fracturas abiertas, cirugías colorectales, cardiotorácicas, vasculares, pulmonares, podiatría, cuidado crítico, y se puede utilizar también en emergencias. Tiene muchísimas aplicaciones, sobre todo para las poblaciones de alto riesgo, diabéticos, pacientes con pacientes inmunocomprometidos, mayores de edad, o casos de alta tasa de infección, cirugías colorectales, cesáreas, trauma abdominal o ortopédico. Siempre hay una alta tasa de infecciones o procedimientos donde se colocan implantes. Y esto es todo de mi parte. Muchísimas gracias por su atención. Si es que ustedes tuvieran preguntas o si requieren información adicional, pueden visitar nuestra página web que se indica en la lámina, o pueden mandar un correo al doctor Oswald García, vicepresidente de nuestra área de negocios internacionales, y tienen también su correo indicado en nuestra diapositiva.